Have you ever experienced that burning sensation in your throat after eating a huge meal? Or maybe you've wondered why some people take medications before eating to prevent stomach discomfort? Well, the pharmacists have created this magical little pill called protein pump inhibitors that basically help you with this discomfort. Hello, I'm Dr. Magnin and I'm a second year pharmacy student, and today in this video I'll talk about protein pump inhibitors. In this video I'll break down why is your stomach acidic, how protein pump inhibitors actually work, what are the therapeutic applications of PPIs, and what are the side effects and interactions of PPI. So you don't want to miss anything, so stay till the end. What is protein pump inhibitors? Protein pump inhibitors like omeprazole, esomeprazole are a class of drugs that decrease your stomach acidity by inhibiting the production of gastric acid. But before I talk about what PPIs actually do and how they work, I have to first explain the anatomy and physiology of your stomach. How and why your stomach produces acid. The stomach produces an acid called gastric acid, which is HCl, hydrochloric acid. It's used for digestion and defense, and also for absorption of certain materials. The high acidity, for example, is important for the denaturation and breakdown of proteins into amino acids. You know, all these bodybuilders, they're taking their proteins. Well, the proteins then in your stomach are going to break down into a simpler amino acid, which your body then can absorb. The gastric acid is a line of defense against harmful pathogens. You know, it's so acidic that bacteria are going to denaturate just like the protein, and they're going to break down and you're not going to get infections. If you zoom in on the stomach, you will see that the stomach consists of these cells called parietal gastric cells. These cells are behind the production of gastric acid. They're activated by the molecules histamine, acetylcholine, and gastrin. For example, you have thought about eating food, or for example, you have actually eaten food. There's certain signals, there's certain pathways that activate these molecules, and these molecules will go and attach to the parietal cells and activate the parietal cells to produce gastric acid. Inside the parietal cell, we have something called proton potassium ATPase, or protein pumps, and they're activated by an enzyme called proton potassium ATPase. These proton pumps pump out proton into the stomach to then combine with chloride to produce the gastric acid. So if you think about it, we have these parietal cells which are activated by histamine, acetylcholine, and gastrin. They have these pumps called proton potassium ATPase, and they're activated by an enzyme called proton potassium ATPase. And what happens is that the parietal cells are going to produce and they're going to pump out protons into the stomach lumen, and they're going to combine with chloride to produce the gastric acid, which makes the stomach acidic. Now that you understand anatomy and physiology of the stomach, it's much more easier to understand how PPIs actually work. What is the mechanism of action of proton pump inhibitors? So after you've taken your proton pump inhibitor, for example, omeprazole, what happens is that it's going to enter the bloodstream and it's going to reach its target cell, which it's parietal cell in our case, because that's where the gastric acid is being produced. It's going to enter the parietal cell and it's going to exert its action, which is it's going to be decreasing the gastric acid production. Do you remember in the parietal cell we had an enzyme called proton potassium ATPase, which activated, and this is how the proton pumps actually work. What happens is that the omeprazole or proton pump inhibitor binds to this enzyme and blocks it from working on the proton pumps. So what happens is that the proton pumps basically stop working and there's going to be stop pumping out the protons. Yes, you might even get your signal from acetylcholine, gastrin, or histamine, but because the proton pumps don't work anymore, the protons are not getting pumped. And in turn, it's going to decrease the gastric acid production. We just learned so many useful information. Now let's actually have a practical use for it. What happens is that sometimes, and there's a lot of times, there's excessive gastric acid production and secretion. And what happens is that the proton pump inhibitors, they target this gastric acid and decreases it, and it's basically useful in certain conditions. For example, GERD, or gastroesophageal reflux disease. This is when there's an excessive gastric flow back into the esophagus, which causes heartburn and irritation. Proton pump inhibitors here reduce the gastric acid, which prevents it from further damage and allows the esophageal lining to actually heal. Another condition is peptic ulcers. They're open wounds and sores in the stomach or duodenum, which could be caused by bacteria like Helicobacter or NSAIDs, which is a class of drugs. What PPIs achieve is reduce the gastric acidity, which allows it to heal and recover. Another condition is the Zollinger-Ellison syndrome, which is excessive gastric acid production due to tumors. Proton pump inhibitors help control the hyperproduction and secretion of gastric acid, and is going to basically alleviate some of the symptoms. Proton pump inhibitors are really safe, and this is not medical advice, it's just for educational purposes. So what are the potential side effects, adverse effects, and interactions of proton pump inhibitors? Proton pump inhibitors can affect the absorption of certain nutrients, for example, calcium, magnesium, and vitamin B12. Vitamin B12 is actually absorbed from the stomach. When you decrease the gastric acidity, it's going to interfere with the absorption of these nutrients, and it's going to lead to some malnutrition of these nutrition. Just imagine what's going to happen if you have, low levels of calcium or magnesium. It's going to affect certain part of your bones and your muscles and stuff like that. Also, there's an increased risk of infections because what happens is that gastric acidity is used to prevent or to protect us from the pathogens. It basically destroys the pathogens, but now the acidity gets a little bit less acidic, and it's going to basically allow certain bacteria that are more resistant to acidity to survive, and which then might lead to infections. PPIs like omeprazole can inhibit and decrease the liver metabolism enzyme CYP2C19, which has various important functions in metabolizing drugs. It can interact with other drugs metabolized by CYP2C19 and either increase or decrease their action. For example, in the case of clopidogrel, because the metabolism leads to an active version of the drug, decreasing metabolism of clopidogrel decreases its effect. Just know that omeprazole can affect drug metabolism and can lead to interactions. Drug metabolism is a very interesting topic, but I'll gonna keep that for another video. So in conclusion, proton pump inhibitors manage symptoms and disorders that are related to increased gastric acid production. We talked about all of those things like how the stomach works, what are the mechanism of action of the proton pump inhibitors, and certain therapeutic applications of proton pump inhibitors. If you found this exploration of proton pump inhibitors insightful, consider sharing your questions and your experience in the comment down below. Please comment how is your experience with all of these drugs, and don't forget to subscribe for more deep dives into the world of pharmacology, medicine, and science. Thank you for watching and stay curious. And also there's my crypto wallet. Please donate to me because I'm a pharmacy student and I would love to make some money. Thank you.